Hi ma'am, I'm Mae Silvestre, BSN 2-1.
So for today's presentation, we will have the anthropometric measurement.
And now, here's the following checklist or guidelines to do the anthropometric measurement. We have purpose, assessment, planning, and procedures. What is the purpose of anthropometric measurement? The purpose is to assess the well-being of the newborn. What are the assessment for anthropometric measurement? The first assessment, check if the weighting scale is functioning well or not. Second assessment, check for air drops. What are the planning for anthropometric measurement? Prepare the following materials needed: weighting scale, tape measure, pair of gloves, adequate source of light, and examination table. These are the following procedure in performing the anthropometric measurement. Step 1. Place weighting scale on top of the examination table. Step 2. Reset the scale to 0. Step 3. Wash hands and put on gloves. Step 4. Place naked newborn on the covering part of the scale. Step 5. Position the newborn to minimize stress. Remember, keep one hand over the newborn's body. Step 6. Quickly note the weight. Step 7. Remove the newborn from the scale and continue with care. Step 8. Remove gloves and wash hands when care is completed. Step 9. Document the weight in the newborn's medical record. Step 10. Assessing the head circumference. With the infant lying on a supine position on the examination table, place tape measure behind the infant's head and run across the most prominent part of the infant's head. Always remember, do note the measure value. Step 11. Assessing the chest circumference. With the infant lying on a supine position on the examination table, place tape measure behind the infant's back and run across the chest. Make sure the tape measure is running across the infant's nipple line. Always remember, do note the measure value. Step 12. Assessing the abdominal circumference. With the infant lying on a supine position on the examination table, place tape measure behind the infant's waistline and run across the infant's abdomen just above the navel. Always remember, do note the measure value. Step 13. Assessing the infant's length. With the baby still naked, grasp the baby's feet with your non-dominant hand. Position the tape measure behind the infant's sole. Lift the infant in an upside-down position. Run the tape measure from the sole, behind the leg, thigh, buttocks, back nape occipital area to the anterior fontanelle. Remember the two things. First, if the infant is big, it's better to use the lateral position with the baby on top of the examination table. Second, this is also a safe method in measuring the infant's length, especially if the nurse is alone. Always remember, do note the measure value. Step 14. Continue with other care. Step 15 and the last step. Remove gloves, do hand washing, and document the procedure and findings in the infant's chart.